Hello viewers, once again welcome to my new lecture. As you know, we have already discussed about the safe drugs used in pregnancy. Today my presentation topic is the use of anti-tubercular drugs during pregnancy, or you can say these are the safe agents or safe drugs which are used during pregnancy. So for the treatment of tuberculosis during pregnancy, isoniazid is considered as a safe agent, which is also given in figure number 5. As we know that there are different anti-tubercular drugs, so like isoniazid, ethambutol, pyrazinamides, and many and more agents, rifampicins, and many and more agents they are used. So it is also very important to notice that nowadays in our societies, the people, so they are using the drugs in a wrong way, or you can say especially during treatment protocol. For example, let's suppose if a pregnant woman she can visit to our clinic. So I think this is very important that during medications, so you should take too much cares regarding the use of drugs. So isoniazid, this drug is used to treat tuberculosis infection. So it doesn't have any adverse effect on the fetus according to the different literature, and with the combination of vitamin B6 avoid the fetal neural damage. And other drugs like ethambutol, rifampicins is also safe to use. I mean, all these are anti-tubercular agents which I have mentioned here, so you can use it during pregnancy. These are safe, but it can be used in a combination with other agents like vitamin B6, which can be recommended to the pregnant woman, so in order to avoid the fetal neural damage. Okay, now come to anticoagulants. So anticoagulants, you know, these are the other agents like heparin. So heparin is also known as anticoagulant, and it is used as a safe drug during pregnancy to treat thrombolytic disorder or thrombotic disorders. Heparin, it is an anticoagulant which prevents the formation of blood clots. So whenever there is formation of blood clots, so these different anticoagulant agents, so they are used. So it is also used to treat the blood clots and the arteries and veins. So it is a drug of choice during pregnancy as it doesn't show any adverse effect on the fetus. So different literature they have already shown here. So this is, I think you can say, practical application of these drugs. So you can heparin, this is also, you can say, so this is safe. It is also safe during pregnancy as it doesn't show any adverse effect on the fetus. Now let's see here. Okay, this is the anti-tubercular and anticoagulant drugs safe in pregnancy. This is the chemical structure. So you can see here, this is the chemical structure of all these anti-tubercular and antifungal, or you can say anticoagulant drugs which are safe in pregnancy. So that is isoniazid. So isoniazids, you know, this is anti-tubercular agent, while heparin, so this is anticoagulant, while furosemide is diuretic. So all these are safe drugs which can be used during pregnancy. Diuretics are so another group, that is diuretics, you know. So diuretics are intended to use for increase in urination and commonly used to reduce the blood pressure and the hypertension condition. So I will show all these things in the figure number 5. Furosemide, it is a strong diuretic that is used in the treatment of edema. So it doesn't show any toxic effect, but it can cause hyponatremia and hypokalemia and neonates. So it can be used in other serious maternal illness like refractory hypertension when other drugs become unresponsive. So it is strictly prohibited. So for example, let's suppose, so whenever we are going to treat any conditions and that is related to pregnancy, so you should use all these agents with precaution. So actually the drugs which I'm going to highlight, these are the agents which are safe in pregnancy. But still, if you have any problems, drug related problems, so you can consult with the pharmacist, or you can say any drug expert. Now come toward the miscellaneous agents. The tetanus injectable preparation is administered during this second and third trimester of pregnancy to prevent the tetanus. Probenecid, so it is administered along with penicillin, and it is safe to be used during pregnancy. So you can see here all these things, they are already mentioned here in the tables. So calcium and vitamin D, you know, so these can be safely given, and the deficiency states and in accurate doses. Okay, so this is in table 1 a list of the safe drug during pregnancy. Let's see here in serial number 1, safe drugs in pregnancy. The first one is analgesic drugs. So analgesic drugs, so it include paracetamol, pethidine, Indomethacins, and Allopurinol. Analgesic drugs, or you can say analgesic, antipyretic, chronic arthritis and connective tissue disorders, gout, and kidney stones. So I mean that all these agents which I have mentioned here, these are used in the variety of conditions, like antipyretic, chronic arthritis, and many and more disorders. These are the side effects which are reported in the fetus. No fetal abnormalities have seen or observed. So administered at the first stage of labor, 6 to 8 hours before delivery. While and serial number 2, you can see the gastrointestinal agents like laxative, antiemetic, and anti-diarrheal. It's mainly the clinical indications, or you can say the benefits and constipations, or you can say it inhibit the action of emetics and diarrhea. So there is no teratogenic or adverse effect reported. So the treatment of morning sickness during first trimester or antispasmodic during pregnancy. The third one is anti-asthmatic agent. So for example, let's suppose if there is in asthmatic patients, so for asthmatic patients, so Ephedrine, Aminophylline, and Terbutaline can be recommended. So I mean, this is very easy to understand that for example, if a patient who is suffering from asthma, if a patient who is asthmatic, and as well as you can say someone is, for example, pregnant, so you can use Ephedrine, Aminophylline, Terbutaline. So it is also used in the treatment of asthma, hay fever, bronchial asthma, and chronic asthma. So there is no such adverse effects and teratogenic effect which is reported by the different literatures. The next one is antihypertensive agents. So antihypertensive agents, methyl, dopa, hydroxyzine, lidocaine. These are also the safe drugs you can use during pregnancy. Hypertension, congestive heart failures, cardiac arrhythmia. So these are the clinical indication of these drugs. But it decreases the fetal wastage and increase the birth weight and length of gestation. But there is no adverse effects reported here. An anti-tubercular agent, isoniazids. So isoniazids, especially this is the drug which is used in the treatment of tuberculosis, but there is no adverse effect has been reported in the literature. While the seventh one is diuretics or furosemide, so which is also in the treatment of edema and maternal illness. No adverse effect is reported. Okay, so now come toward the other categories, like Anticoagulant, so heparines. Heparin is anticoagulants actions which can prevent the, for example, whenever there is a blood clot, or you can say blood clot formations inside the blood vessel. So this is, I think, clear. So it avoids the fetal neural damage. While in diuretics, prosemides, so which is also available in a market by trade name Lasix. The clinical indications are edema and maternal illness, but no adverse effect is reported. While in miscellaneous drugs like tetanus and you can say this is called probenecid. So you know probenecid, this is uricosuric drugs, calcium and vitamin D. Miscellaneous agents, antibiotics regulate the balance of the salt. So there is no adverse effect reported administered in the second or third trimester. Now let's see here. This is, I think, very clear thing. You can see here gastrointestinal agents, drug affiliated with some risk. Now there are some drugs, some of the drugs which are associated with risk during pregnancy and referred as unsafe drugs, which are discussed below and shown in the table 2. Inshallah, I will discuss all these things, and inshallah in my lecture number 3 regarding the safe and unsafe use of drugs. So I'm very thankful to all my viewers who are watching my lectures. So I mean that if you need any kind of help, so I'm always available for your services, and you can directly contact me through my email, so I can share all these contents with the needy peoples, because nowadays you know that there is some kind of, you can say, mass management or self-medication. This is very common, and you know, non-professional people, so they are working and they are practicing all these medicines, so there may be chances of risk. So kindly, it is very important. So if you have any problem regarding the use of medicines, regarding drug related problem, so you can directly contact with the registered pharmacist, with the drug specialist who have knowledge about the drugs, about its use. So you can directly contact with any pharmacist. So this is so once again, I'm thankful to all of you for watching this lecture. So kindly, this is my YouTube channel, so kindly subscribe it, subscribe my channels and watch it, like it, and also press the bell icon for my upcoming videos. Wish you all the best. Thank you.